Hello, welcome. This is Dr. Nitin Jagdhane. I am a consultant neurosurgeon, brain and spine surgeon, currently working at the Seven Hills Hospital, Andheri East, Mumbai. Today we are going to discuss about the spinal fusion surgery. So many times people are afraid that after they get a back pain or they sustain injury, they go to an orthopedic surgeon, spine surgeon, or maybe a neurosurgeon, and they are told that you need a spinal fusion surgery. So what is exactly spinal fusion surgery? Spinal fusion surgery is nothing but connecting the broken parts of the two vertebrae, which was earlier devised for the fracture of the vertebrae, and then later on is being utilized for many causes or many problems which lead to back pain and which are age related degenerative spondylosis, and also for sometimes the tumors which are invading the vertebral bones, which cause the instability of the vertebral column. So as the most common reason why this spinal fusion surgery is done these days is the degenerative spondylotic changes which affect the entire spine. They are mostly affecting either the cervical spine in the neck area or in the lumbar spine, which we usually say as the low back area. So what happens in these conditions is that as the age advances, there is wear and tear, and because of this, the disc, which we call it, between the two vertebrae is degenerated. Sometimes it slips out and it causes the narrowing of the spinal canal, or sometimes narrowing of the vertebral foraminae, through which the various nerves supplying the various parts of the body they are passing. So because the spinal canal or because of the foramen are narrowed, the neural structures, they are compressed, and because of their compression, the patients find various symptoms like pain, especially in the lower back, pain in neck, and it is associated with tingling and numbness of that particular limb, the upper limbs, or maybe the lower limbs, or sometimes in all four limbs. Sometimes they are associated with weakness of a particular limb, weakness of particular action, depending on which nerve or which part of the neural structure is involved or is compressed. Spinal fusion procedure is usually done for the cervical, for the neck pathology, or for the lumbar pathology, either from the front or maybe from the back also. So based on the kind of the pathology, this approach is decided by your neurosurgeon, and there are various techniques, like for in the neck cervical region, the most commonly done fusion is from the anterior, which we called as anterior cervical discectomy and fusion. But sometimes depending on the pathology, the fusion is also done posteriorly also. So that is called as lateral mass fusion technique. In the lumbar region or in the low back, there are various techniques for the spinal fusion. The most commonly done techniques are from the posterior or from the back side in the lumbar region. So in which there are pedicle screw fixation and fusion techniques. Sometimes the cages or the structures which replace the discs are used. Earlier there is still debate going on whether the artificial discs are good or not, but since a long time some support is kept between the two vertebrae, either in the form of bone or maybe in the form of artificial cages, which give the support to the adjacent vertebrae, and they help in realignment of the vertebral column, as well as widening of the spinal canal and the foraminal width, so that the neural structures which are being compressed are relieved, and automatically the pain which patient is suffering from is also relieved. Many a times fusion alone relieves patient's pain, because the pain is not only caused by compression of the neural structures or the nerves, but sometimes it is caused by the friction of the opposing vertebrae because of the degenerative or slip disc also. So once the motion segments are fixed, the pain also is automatically relieved because of the fixation of that particular segment. So this was about the various techniques that are used, but what is done and what is done in these particular techniques. But spinal fusion technique or spinal fusion procedure is not a very simple procedure. It is technically demanding procedure. Sufficiently qualified spinal surgeon or a neurosurgeon can do these procedures, but they also carry substantial risks. The main risks are like failure of the procedure is the first and foremost. Then there can be deterioration of the current neurological condition of the patient. That means there can be paralysis of the region which the surgery is being contemplated. There can be other various problems such as infection if the patients are elderly. Then there can be infection of the suture lines. So based on all these things, these are the early complications, and there are some late complications as well, like the adjacent segment disease. That means the two vertebrae or three vertebrae whichever are fixed, they work as a one segment, and there is a problem at the another levels which are moving, because spine is meant for mobility in human beings. And if we are fixing two or three segments, naturally the adjacent segments which are moving, they are at more stress, and with the age they also start giving up and getting new problems at those particular levels. So what you should expect from spinal fusion is usually the procedures are done for the pain relief, as well as for giving stability to the spine, so that robust rehabilitation programs can be started. And just fixation of the bones is not enough, because muscles in the body are the main structures which hold the entire spine and the entire body. So muscle rehabilitation, muscle strengthening is something which is required more even after any kind of spinal fusion procedures. So if you need any kind of help regarding these spinal fusion procedures, you can visit any of the neurosurgeons or a sufficiently trained spinal surgeon, and they will guide you regarding what kind of spinal fusion surgery is suitable for you, and what you can expect out of this surgery. So this was all about spinal fusion surgery, and if you wish to go through our other videos, you can log into lybrate.com and keep watching the videos. Thank you.